Health benefits of red clover, Trifolium Pratense. Clover is commonly used as fodder, animal feed, and a nitrogen fix for improving soil quality. Beyond the agricultural uses, red clover has medicinal properties that I find to be very important in herbalism. Red clover, Trifolium Pratense, is a herbaceous flowering plant in the Fabaceae legume family. Red clover is native to Europe, Western Asia, and Northwest Africa. It also has been introduced and well established in other parts of the world, such as your pesky lawn. The most common red clover tea comes from the flowers, rather than the leaves or roots. Red clover flowers are commonly used to make tea to cleanse blood and lymph, aid in sleep and hormonal conditions. The flowers contain high amounts of isoflavones. Isoflavones are plant-derived estrogens, also known as phytoestrogens, and act similar to the hormone estrogen. These phytoestrogens are used as an alternative treatment for estrogen-related conditions, such as hot flashes, breast pain or tenderness, and premenstrual syndrome. Red clover health benefits. Some of the health benefits and uses of red clover may include sedative, antispasmodic, calm the nervous system, sleep aid, skin conditions such as skin cancer, skin sores, burns, eczema, and psoriasis, expectorant, anti-inflammatory, anti-cancer, protection from bone loss, increased bone mineral density, diuretic, asthma, gout, and whooping cough, bronchitis, STDs, protect the brain, protect the cardiovascular system, detoxify the lymphatic system, cleanse blood, reduce menopausal symptoms, heal metabolic syndrome, may be able to halt the progression of prostate cancer by inducing apoptosis in low to moderate grade tumors, and inhibit human glioblastoma cells. Possible side effects of red clover. As with all herbs and foods, there can be possible side effects. Red clover may increase the chance of bleeding due to its anticoagulant properties. Since it may increase the risk of bleeding, it's important to stop consuming it at least 2 weeks before surgery. Red clover contains phytoestrogens, which may affect hormone-sensitive conditions such as breast cancer, uterine cancer, ovarian cancer, endometriosis, or uterine fibroids. People with protein S deficiency may have an increased risk of forming blood clots because of its estrogenic effects. Red clover contains various phytochemicals such as isoflavones, flavonoids, pterocarpins, coumarins, coumestrol, tyramine, formononitin, biochanin A, naringenin, myricetin, salicylic acid, eugenol, aglycones, daidzein, genistein, glycitine, pratensian, arilone, oribol, pseudobaptoginin, prunitin, and malonoglycosides. Biochanin A and formononitin were found to be the predominant isoflavones found in all cultivars and parts of red clover. The isoflavone concentrations were found to be different depending on early and late flowering stages. Red clover and skin conditions. Red clover has been used as a topical aid for various skin conditions, such as relieve pain for eczema and psoriasis, treat burns, sores, and even skin cancer. This may be due to the anti-inflammatory compounds found in the flowers, eugenol, myricetin, and salicylic acid. Red clover and cardiovascular disease, atherosclerosis. I believe this information may be useful to medical practitioners, so I want to show the results of this study. Results: red clover extract and the isoflavones genistein and biochanin A were moderate PPAR alpha activators. Daidzein only slightly activated PPAR alpha, but its metabolite 6-hydroxydaidzein exerted a much higher PPAR alpha activity. Similarly, the metabolite 3-hydroxygenistein achieved higher activation efficiency than its precursor, genistein, did. In lipopolysaccharide-stimulated macrophages, red clover extract and its compounds reduced the secretion of pro-inflammatory cytokines, interleukin-6 and tumor necrosis factor alpha, increased the secretion of the anti-inflammatory interleukin-10 and or reduced the expression of nuclear factor kappa B, inducible nitric oxide synthase and or cyclooxygenase. Tumor necrosis factor alpha production was most efficiently reduced by biochanin A and genistein. Interleukin 6 levels were most efficiently reduced by genistein and equal. If you're wondering what the heck that meant, it basically means these results suggest red clover may reduce inflammation associated with cardiovascular disease. It may help prevent cardiovascular disease related to atherosclerosis. Atherosclerosis is caused by arteries narrowing due to plaque building up on the artery walls. It makes sense that red clover would help since it's traditionally known as a blood cleansing herb. Part of this study mentioned red clover extract and its compounds reduced the secretion of pro-inflammatory cytokines. Stephen Buhner's protocol to treat Lyme disease involves cytokine cascade disruption. Red clover could potentially be useful for treating infections by modulating cytokines. That's very good to know. Very good. Red clover for infections. Death from avian H5N1 influenza infections are caused by a dangerous inflammatory response. Since red clover has the ability to reduce the secretion of pro-inflammatory cytokines, it may be able to help treat influenza and very likely other infections. I'd speak about infections more, but this video would become very, very long. Later on, I'll talk more about infections and the cytokine cascade disruption protocol. Red clover isoflavones and bone mineral density. A double-blind randomized placebo-controlled trial was done with 177 women aged 49 to 65 taking a red clover-derived isoflavone supplement, or a placebo, for a year. The data from this study showed the loss of lumbar spine bone mineral count and bone mineral density was significantly lower in the women taking the isoflavone supplement compared to the women taking the placebo. Thus, red clover may be able to be used for preventing bone loss. Red clover menopausal hot flash symptoms. A lot of websites claim red clover has no beneficial effects on menopausal symptoms, but the studies I'm looking at suggest otherwise. I'm willing to admit more studies need to be done, but that's with medicine in general. A study was done with 30 women with 12 months or more of amenorrhea and having more than 5 hot flashes per day. The study actually says hot flushes, but most of us know it as hot flashes, so I'm replacing their word flush with flash. During the first phase, all participants were given single-blind placebo tablets for 4 weeks. During the second double-blind phase, participants were randomized to take either a placebo or 80 milligram isoflavones for an additional 12 weeks. In the first 4 weeks, the frequency of hot flashes with the placebo decreased by 16%. During the second double-blind phase, a statistically significant decrease of hot flashes by 44% was found in the group that took isoflavones. The placebo group had no additional reductions. Red clover significantly decreases postmenopausal symptoms. 60 postmenopausal women greater than 40 years of age, not using conventional hormone therapy, HT, with a Kupperman index score of 15, participated in a double-blind randomized study to take either a red clover isoflavone supplement or a placebo for 90 days. After 7 days of a drug washout period, the participants were then given the opposite treatment for 90 days. They found no significant difference on their body mass index, weight, or blood pressure during either phases of treatment. However, their Kupperman index score was found to have significantly decreased after each treatment. The decrease was more profound after taking isoflavones compared to placebo. Their baseline Kupperman index score was 27.2 plus or minus 7.7. With the isoflavone supplement, 5.9 plus or minus 3.9. Placebo, 20.9 plus or minus 5.3. This study concluded red clover isoflavone supplementation significantly decreased menopausal symptoms and positively affected vaginal cytology and triglyceride levels. But other people are saying otherwise. I don't know. Who do you want to believe? Red clover works better with ginkgo biloba. A study found red clover and ginkgo biloba minimized neurological damage caused by sodium arsenite-induced neurotoxicity in different parts of the brain in rats. This suggests taking ginkgo biloba with red clover, Trifolium Pratense, provides additional neuroprotective properties together. Please don't leave vegan comments. I know, rat studies suck. Red clover works better with pomegranate. Researchers knew pomegranates have strong antioxidants and positive effects on postmenopausal symptoms, so they decided to try combining pomegranate concentrate powder, PCP, not the drug, pomegranate concentrate powder, with red clover, RC, to see if the positive effects could be enhanced. Those effects were indeed enhanced. They found bone mineral density increased significantly in overreactomized rats taking red clover and pomegranate concentrate powder together. Red clover phytoestrogens, estrogenic cancer. Here's where things get a bit conflicting. Red clover acts as an aromatase inhibitor. The enzyme aromatase allows for aromatization of androgens into estrogens. An aromatase inhibitor reduces estrogens by inhibiting the aromatization of androgens into estrogens. The problem is that red clover also contains isoflavones, also known as phytoestrogens, which are similar to the hormone estrogen. Phytoestrogens could potentially promote cancer growth. Yes, this also contradicts the lymphatic system detoxification properties of red clover to reduce cancer. To make things even more complicated, CYP19 is located on chromosome 15, and it plays a role in aromatization, resulting in the production of estrogen from androgens. The isoflavone biochanin A, found in red clover, was shown to inhibit CYP19 activity and gene expression, potentially reducing the risk of breast cancer. This simply means biochanin A in red clover acts as an aromatase inhibitor, stopping the production of high estrogens associated with breast cancer. Let me explain it one more time in layman terms, or at least try. Red clover can inhibit the production of estrogen, which is good because high estrogen can promote the growth of cancer. But red clover also contains plant estrogens, which may be able to promote the growth of cancer. Although normal levels of estrogen shouldn't promote rapid cancer growth. If estrogen levels are within range while taking red clover, then hypothetically it shouldn't be an issue regarding cancer growth and may even be able to reduce cancer, including cancer via inhibiting CYP19 activity and gene expression. That's a tough one though. Perhaps one day we'll find out that red clover acts as an estrogen modulator, or that those phytoestrogens function safer in the body with estrogenic diseases. As of right now, taking red clover for cancer is very likely a hit or miss until further studies are done. To make things even more complicated, CYP19 is located on... To make things...